someone you know ever experience heartburn? If so, how often? Symptoms range from pain to discomfort, but what exactly causes those symptoms? Let's say you're out at lunch with some friends and you decide to indulge in some pizza and buffalo wings and wash it down with a nice cold beer. Hours pass, you go on with your day. Now it's time for bed, so you lay down and you drift off to a peaceful sleep. Imagine being woken up with a pounding heartbeat, excessive salivation, a burning sensation in your throat, and the urge to vomit. What do you do to avoid these symptoms from happening again? Do you take Tums, Prilosec, Pepto-Bismol, drink water? Now imagine experiencing those symptoms after everything you eat every single day. I lived that way for over 6 months. I thought it's just heartburn. I'll avoid eating spicy foods and greasy foods. I ate 4 hours before bed. I slept sitting up, a little bit elevated, just to avoid the acids in my stomach from coming up to my esophagus. After trying everything in my power to avoid these symptoms, I couldn't take it anymore. I sought medical attention. I met with my doctor, and he suggested for me to undergo a procedure called an endoscopy. Now, in an endoscopy, doctors put you to sleep and they insert a small camera through the throat, down the esophagus, into the stomach, into the digestive tract, and remove a small biopsy of tissues for further examination. When my biopsy came back, my doctor told me that I had H. pylori. Helicobacter pylori bacteria is an infection that is found in the digestive tract. It can cause unintentional weight loss, loss of appetite, frequent burping, nausea, frequent heartburn, and other symptoms. To rid this bacteria, one must go rounds of probiotic and antibiotic treatments, and then a breath test can be administered in order to see if the bacteria is out of the system. Now, H. pylori is very common. In fact, it is found within 2/3 of the world's population. In China, a simple randomized study was conducted involving 105 patients. 70 of them were H. pylori positive and 35 were H. pylori negative. These patients were split into groups A and B. Group A received a 14-day trial of treatment involving 1,000 milligrams of amoxicillin and bismuth-containing quadruple therapy. Group B also received the bismuth quadruple therapy plus 40 grams of C-butricium 3 times a day for 14 days. Researchers gave this medication to the patients in order to distinguish a difference between the H. pylori positive and H. pylori negative groups. Feces samples, blood samples, and breath tests were administered. No significant improvements or differences were found in both groups, but researchers did find 38 different species of fecal bacteria growing in the H. pylori positives group. Now, in conclusion, the researchers did find that approximately 20% of H. pylori infected patients can develop further complications and illnesses. These illnesses can be colon polyps, stomach cancer, ulcers, internal bleeding, and unfortunately, I fall into that 20%. Now, doctors don't exactly know the reason or the cause for individuals being infected with H. pylori. Since it is found in the digestive tract, it's harder to pinpoint exactly where and how and why a person might have contracted it. But if you or someone you know experience symptoms of heartburn or excessive symptoms of heartburn, avoid trigger foods. Write down the things that make you feel these symptoms. Eat 4 hours before bed. Monitor your alcohol consumption. And if you think it may be H. pylori, seek medical attention, because if it's left untreated, it can become far worse. Nobody should go to bed sitting up like I did.